And then we will have time after all three of them speak to have a little bit of discussion and question and answer. So please take it away, Nevin. I think it should be on now.
It's on?
Yeah.
Hi everyone. My name is Nevin Ivanovic and I'm the Public Policy Coordinator at the Women's Center of Calgary. Let me first say, wow, these speakers are a tough act to follow. I am so grateful and honored to be here, to be invited to be a part of this conversation, and to be a guest here in Edmonton and on the 6th territory. So the Women's Center of Calgary is a community hub and a safe space for the women of Calgary to get assistance with their basic needs, to connect to other women, and to work for change. We connected with over 9,000 women in 2018, and while the center is open to any woman in Calgary, about half of the women in our community have experienced poverty. So in our advocacy work, we strive to bring their voices to the public policy tables and to advocate for solutions that improve their lives. I'm not sure what I'm doing, just moving my head.
That is awful.
Is it hard to hear?
Yeah.
It's just, yeah, it's kind of on and off, right?
Yeah, it is. Can you put it a little closer to your mouth, Davina? Try that.
Sir, we're going to...
Don't point it at
Hello.
these speakers.
We're going to switch to this mic because I don't trust these mics.
Sorry about that. Sorry for moving my head.
Not your fault.
Is this better?
Yes.
Hopefully just hold this. Okay. So I've been asked to speak today to provide a gender lens on poverty in Alberta, an intersectional gender lens, and within that to chart some specific actions that are necessary or that would be effective in significantly reducing or eliminating women's poverty. So we heard so much from Sandra and then from Sarah about poverty in Alberta and in Edmonton. And I'm really just going to give a much shorter snapshot. I really just want to speak, kind of give a wider context of women's economic inequality in Alberta. Continuing with a few numbers to illustrate gaps and highlights women's vulnerability to living in low income, as well as some stories from the front lines from the Women's Center. And finally wrapping up with a few actions that governments could take to improve women's economic security and significantly reduce their vulnerability to living in poverty. So I'm grateful to Sandra for the introduction of measures. When I'm talking about poverty, I will stick to, or I will rely on the numbers that are based on the MBM. While of course I believe that as a complex phenomenon, poverty definitely deserves several measures, but for an absolute measure of low income, here I'll just use the MBM. And especially since we're talking about kind of relating women's poverty to their male counterparts and so on, any poverty measure really would be illustrative in that respect. So over time, the gap between men's and women's poverty has narrowed, but women, as we heard already, are still more vulnerable to living in low income than men. Overall, despite some recent gains for women, many gender inequalities persist in Alberta, and they're often worse for marginalized groups of women. So, women's employment, despite a strong increase in 2018, is still lagging behind men's. When women work, they're twice as likely to work part-time. Women in Alberta also face a large earnings gap. Overall, they earn only 63% of what men earn in Alberta, and the gap for Indigenous and racialized women is even wider. They earn less than white women, and they earn less than their male counterparts. So for example, in Edmonton, average earnings of a racialized woman don't even amount to a half of average white man's earnings. Even when we look at only full-time, full-year workers, women's wages are still 80 cents to a man's dollar. And it's not about qualifications or choice of occupation necessarily, although some of it has to do with that perhaps. Women are actually paid less than men when having the same qualifications, and in almost all occupations that exist out there in the classification, men out-earn women. So compounding these factors is Alberta's economic reliance on the oil and gas sector. While underrepresented in well-paying jobs in the industry, women and racialized workers are overrepresented in the service, retail, and care work in the oil sands region, but also in the economy at large. So for example, 1 in 3 women in Calgary earn less than a living wage, and just a reminder that for Calgary that's $18.15, while this is the case for 1 in 5 men. At home, women perform a disproportionate share of the household work, including care for children and the elderly or disabled members of the household. According to the most recent available data, women in Alberta actually put in 35 hours of unpaid household work a week compared to 17 hours by men. So that's kind of like a full week of work just in unpaid work. So this burden, when we combine it with the fact that childcare is hard to access and afford for many, it makes women more likely to work part-time or fewer hours and also take more time out of paid employment just to have children, which then impacts their life earnings and how well they do throughout their lifetime and in retirement. Another important factor that determines a woman's economic well-being is the type of family she lives in. So for all the reasons mentioned, women are much more vulnerable to insecurity when living outside of a relationship. And even though while this applies, as Sandra was saying, to single people in general, they are more vulnerable to living in low income than people who live in families with other adults. This is more true for women than for men. So at the Women's Center, when we look at the most recent income data that told us about how effective government transfers have been in reducing poverty, and they have been, although as Sandra said, we can take that with a grain of salt, and maybe it wasn't that dramatic. At the Women's Center, we also look at how different women have been impacted or not, and who are the women who still live in poverty in Alberta. So unattached women and single mothers are more vulnerable to living in poverty than other women and than their male counterparts. Despite seeing poverty rates decrease in Alberta, some women and children still experience high rates of poverty. So for example, if we stick with the MBM measure and what we've seen released recently, 1 in 20 children living with 2 parents now live in poverty, but this is still true for as many as 1 in 6 children who live with a lone parent. And as you know, 4 out of 5 lone parents in Alberta are women. And lone mothers do not only have much lower incomes than lone fathers, so their poverty, the depth of their poverty is bigger, but they also have much lower overall wealth, unsurprisingly. Also, while poverty rates for adult non-senior men and women are kind of both under 9% and they differ only slightly by less than a percentage point. Again, if we look at unattached people in that group, as many as 1 in 4 single women live in poverty, and that's true for 1 in 5 men. And finally, seniors have relatively low poverty rates in Alberta, yet the poverty rate for senior women is still 3 times as high as that for senior men, as more senior women live alone. Also something we've heard from Sandra already. So the stories of women we hear at the Women's Center bear all of this out, and I'm just going to share some of them. When I talk to our staff and volunteers about the paths to poverty of women who use the center, the first thing that comes up that they say is life events. And that means both divorce and illness. So newly single moms, often previously not working, are struggling to find any or affordable childcare that would enable them to be employed full-time or pursue training or education that would get them a better job that would actually pay bills. Then we have older women who are not yet seniors, so they don't qualify for government pension, who get sick or have a disability and who are alone and find that their pension plans, if they have them, or income support are just simply inadequate. Recent immigrants may struggle with accessing services that they need, especially if childcare and transit costs are just a barrier to stepping out of the house. And then, of course, there's the intergenerational poverty as an ongoing situation that some women have never been able to step out of, and this is often true for many of the Indigenous women who come to the center. A recent development has been an increase of literally hungry women who use our food programs, and we found that this supports data on the rise of housing costs in Calgary in particular, in Alberta, and that they're squeezing out other basic necessities such as food. So based on all of this, we have identified some actions that we know can help lift women out of deep poverty, but also reduce their vulnerability to life shocks. And I will focus on just a few ones. So first we want to recognize that steps have been made, and when you think about women's earnings have increased over time, and we've heard Sandra point out that lower families on average, a lot of their income comes from earnings. But overall, government transfers do lower the poverty rate significantly for women, and they also reduce the large disparities that exist between women's and men's market incomes. Transfers have the greatest effect on women single parents and on elderly unattached women. And looking over time, we've seen child benefits become more effective at reducing poverty, and we see that in the boost that CCB and ACB have provided to families here in Alberta. And we've also seen social assistance kind of being less effective, and we know that from knowing that we have woefully inadequate social assistance benefits here. So to tackle income poverty, we need to make sure that all employment wages are living wages. But for all incomes to be livable incomes, we need recognition that social assistance benefit levels are just inadequate. This is a system that strips people of their assets, of their dignity, and the costs of keeping people in poverty are just borne by all of us. So the recent indexing of social assistance and age is a small step in the right direction. We would like to see immediate increases and changes in how eligibility is determined for social assistance, but in addition, the Women's Centre and a lot of our partners and fellow advocates in Calgary also believe that the government should pursue an idea of a basic income guarantee, basically looking to create an income floor below which no Albertan would fall. They could either do this by topping up existing incomes or just providing a livable income for those who are unable to work. And then we could truly come close to eliminating income poverty. Another aspect of economic well-being for women are strong public services, and that for us includes truly universally accessible, high-quality, affordable childcare. I know we'll hear more about that. So I'm excited to hear more about those municipal efforts in Edmonton. Specifically, what we focus on in Calgary is also affordability of transit, and two additional areas for poverty reduction are certainly safe and affordable housing. We also in Calgary have a shortage of stock, and I believe we are the Canadian city with the lowest percentage of non-market rental stock. And then the other is social services that can tackle barriers to inclusion and also help women leave violent situations. But to wrap up, I just want to say that poverty reduction measures have made and can make a real difference in the lives of women, but they have not necessarily advanced gender equality, which is always, when you think about it, at the root of how women experience poverty. So we believe that we need to also put women's equality more strongly on the agenda, to resource it, and to make closing gaps a priority. So we need to pursue pay equity measures and look at why women's work is devalued and how we can acknowledge it and share it in society and in families. And we need policies that target discrimination against Indigenous women, racialized women, and women with disabilities. And we need all of us, decision makers and advocates, to put in the long-term work necessary to achieve equity goals. So thank you very much.
Well, that's kind of makes you happy to be a woman. So much work to do. Yeah. Thank you so much for having me here. And my name is Sandra Azokar, and I am the Executive Director of Friends of Medicare. If you're not familiar with our organization, we have been around since 1979, promoting the protection and expansion of our public health care in Alberta and in Canada. We are an nonpartisan organization, and we do political advocacy. So election time is a very busy time for us. We, in Canada, we will be seeing in the next couple of weeks a provincial election, and sometime later in the year we will be seeing a federal election. So both of these political episodes will actually impact have significant impact on what I want to talk to you about, which is pharmacare and the role that pharmacare has in being part of a poverty reducing strategy, as my colleague was talking about here. For us, the provincial election is certainly a referendum of whom you can trust to take care of your loved ones, and so keep that in mind when I'm talking about pharmacare. Just to kind of give you a definition of what social determinants of health is, the World Health Organization defines social determinants of health as the condition in which people are born, grow, live, work, and age. These circumstances are shaped by the distribution of money, power, resources at global, national, and local levels. They are mostly responsible for health inequalities, the unfair and avoidable differences in health status seen within and between countries. So poverty is definitely one of those social determinants. From a class analysis, we know that poverty and health go hand in hand. People in poverty are more likely to use the healthcare system because of physical and mental health issues or illness, and be more likely to face an early death. Stress, poor nutrition, inadequate housing, and unstable social environments are often the reason for this. As my colleague was talking about, from a gender analysis, we know that gender plays a huge role in poverty. Women in poverty are often unable to afford important health services that are not covered by Alberta Health. The reason being, as she pointed out, precarious work, part-time work, and unpaid work that women are involved in. So some of these services, important services, include prescription, dental and vision, and physiotherapy services that are not covered by Alberta Healthcare. For my presentation, I'm just going to focus on a serious area that we have actually been advocating for quite a significant amount of time, and that is a concern when people cannot afford medications, when they do not get the needed medications, which often means chronic conditions can go untreated permanently or until emergency services become necessary. And the effects of poverty to an individual's health and the cost to the entire healthcare system has been demonstrated by this research, and it simply has become unacceptable. In many cases, Canadians requiring medication face impossible decisions, like purchasing their drugs or putting food at the table. Those who are able to fill their prescription often need to rely on insurance or constant careful saving. These prescriptions, ranging from cancer treatments to insulin to antibiotics, are fundamental to our healthcare, and the lack of a national drug plan simply puts our collective health in serious jeopardy. When we consider the role that poverty plays, pharmacare is logically an important part of a poverty-reducing strategy. And that's what I want to focus on today. After years of advocacy, Canada is at the cusp of a national pharmacare program, dramatically improving the lives of all Canadians. We have the opportunity to implement a plan that will meet the needs of all Canadians, and we all need all provincial and territorial leadership at the table in order to create the best program possible. It is the most important health reform in the country today, and it would be the largest expansion of Canadian Medicare since the advent of our universal Medicare insurance in 1960. So we're in the middle of a very historical opportunity here. And I think all politicians are quite aware of the significance of what could potentially happen in the next couple of months. Canada is the only country with a single-payer universal healthcare system that does not cover prescription drugs. This translates into the fact that 1 in 10 Canadians are unable to afford prescribed medication. In Alberta, it's even higher. 1 out of 5 households in Alberta experience financial barriers to getting their prescribed medication, and approximately 1/3 of Alberta's workers don't have any health benefits. Barriers to access not only mean that people don't get the medication they need to live a healthy life. Are you kidding me? But our health system becomes burdened in emergency responses and hospitals by those who are sick with an avoidable illness. Sadly, the universality of our Medicare system ends as soon as you get a prescription, as we know. Then you're left on your own. Work plans are not always reliable. In Canada, you can lose your job, you can get a divorce from your partner that has the benefits and so forth. Right currently, we have over 113,000 private plans and 70 public plans that cover people differently. So sometimes unaffordable co-payments create a barrier for people filling their prescription. In Alberta alone, we have 23 public drug plants that cover only 20% of the population. There's about 900,000 of the 4 million people that we have. Yet consistently we see this area being among the top 3 expenditures of our healthcare. So this patchwork is definitely not working. Costs related to non-adherence to prescribed medication is an important health consideration. There are currently about 100,000 needless admissions to hospitals every year resulting from non-adherence to prescription costs. Cardiovascular events have cost the Canadian healthcare system over $93 billion per year. In May of 2018, the Canadian Federation of Nurses Union put out a study entitled Body Count. You can get copies of that at the back. And that study reported that there's about anywhere between 370 to 640 premature deaths of Canadians with heart disease. And about 270 to 420 premature deaths of working age Canadians with diabetes every year. That's over 1,000 people that die because they cannot afford medications. Just let that sink in. Apart from the huge and unquantifiable human cost, we know that, skip all those. Currently, there's absolutely no economic reason preventing us from joining all of the other OECD countries that include prescription drugs. Pharmacare would only require about a 2% increase in federal spending, and it would save Canadian households and employers over $16 billion annually. $7 billion for households and about $9 billion per employer. So we know that over the past decades, credible research, all kinds of reports have noted that Canada, this pharmacare program is overwhelmingly supported by all Canadians and by all studies, so it's time that we act now. I will definitely, in the wrap-up, and hopefully you'll ask me the questions that I need so I can provide you with more information about what we're doing. So I don't want to go over my time, sorry. That was not 10 minutes, Joe French.
This one? Yeah. Okay. So, good afternoon. I'm Nikki DeBlanco. I sit on the board of the Association of Early Childhood Educators of Alberta, and I represent this association at the Edmonton Council for Early Learning and Care, which is a subcommittee of the End Poverty Edmonton initiative. So, and as you've heard, that End Poverty Edmonton has identified affordable and high-quality childcare as one of the 6 game changers to help lift families out of poverty. I have to say I've been so embedded in this one area of End Poverty Edmonton that today has been so enlightening for me to see sort of the bigger picture of, because I've been working even just as a volunteer, but working on this for a couple of years now, so it's been really helpful to see the larger picture of End Poverty Edmonton, and I hope this is helpful for everyone to sort of see how we've dug deep on this one game changer. I also have to mention that I'm sitting in front of my social studies teacher from high school, so I'm expecting a great at the end. I'm a little nervous. So priority number 23 in the End Poverty Edmonton strategy is to plan and implement a system of early learning and care, and that is a loaded statement. So essentially, we need to think about early learning and childcare differently, and think about how we plan for it, and then how we manage and organize it. So, early learning and care in Alberta, for the most part, lives in a market system, meaning that families purchase childcare spaces. And if they can afford to, they can purchase a childcare space within the regulated and licensed system. However, many families cannot afford to buy into the system because the monthly cost of childcare, for instance in Edmonton, is about $885 per child per month. Maximum subsidy amounts are about $500, which leaves families with a $300 to $400 monthly fee per child, and which is prohibitive, especially with multiple children. So we see less and less subsidized families accessing regulated childcare as childcare fees increase. So this is a big problem. Where are these children? And that families cannot afford this system. And this is only part of the system because of the market system, the market does not respond to effectively serve all children. For instance, the market doesn't plan well for responding to childcare deserts. Places where childcare is essentially absent, regardless whether there are families in need of childcare. This is a map from the Canadian Centre for Policy Alternatives, and the green, it will show you where basically there are the higher concentration of childcare, regulated childcare spaces, and then as it goes to darker orange is where there's essentially zero regulated and licensed spaces. So these are my fancy slides that I put together this morning. So let's just talk about, because we're in the middle of an election at the moment, we can talk about a couple of platforms I thought you might be interested in what's being offered in the campaign in relation to early learning and childcare. So $25 a day childcare is currently being piloted in 122 sites, as the video that Joel showed at the beginning. And it caps fees at about $500 per month per child, which, as you recall, subsidy will basically cover for families that are fully subsidized. The $25 a day centers are also receiving funding to enhance quality by having supports for implementing the curriculum framework and inclusive childcare supports. The centers are also receiving funding to provide wage floors to enhance the wages of early childhood educators working in these centers who are often experiencing poverty themselves. Providing program funding such as this interferes with the market system by flipping the demand side funding, in which programs are funded through families purchasing the spaces, to supply side funding, in which programs are given funding to provide a high quality program, and families pay a capped fee should they afford it. So one of the platforms that you see out there is to expand this program and make it universal throughout the province in all regulated and licensed childcare programs. We've also heard about a voucher system. So a voucher system would basically feed the beast of the market system. So it puts money into the hands of families to continue purchasing spaces without planning for a responsive, high-quality system. So this is further complicated because the current regulated system only has space for about 1 in 3 children that need it. So even if we do give families money to purchase these spaces, we're not planning for the system that we need to support these families. So this brings us to the Edmonton Council for Early Learning and Care. So we've talked about the Mayor's Task Force for Elimination of Poverty and how early learning and care was identified as a game changer. So for a couple of years there was an Early Learning and Care Steering Committee that was established to take the necessary steps for implementing the actions. The steering committee included members from the City of Edmonton and Poverty Edmonton, Edmonton Public Schools, Edmonton Catholic Schools, and the provincial ministries of Children's Services, Education, Status of Women, and Health, as well as other members with expertise in early learning and care, mostly from the community. The Early Learning and Care Steering Committee also concluded that the first and most critical step toward developing an integrated system of early learning and care is to establish capacity for management and planning within the city to help change the conditions that perpetuate poverty. It was the hopes of the steering committee that developing local capacity for planning and management could serve as a model for supporting early learning and care elsewhere in the province. And on Halloween, we presented to the City of Edmonton's Community and Public Services Committee, and they accepted the plan for a proposed Edmonton Council for Early Learning and Care, and the first meeting of this council was at the beginning of last month. So we should also note that the steering committee was continuously informed, and the council will continue to be informed through important ongoing work that's provided to us by our Indigenous partners. So there's Indigenous talking circles taking place, and there's also information being presented from the Multicultural Family Resource Society as we continue in this work, and it continues to inform. So The proposed purpose of the Edmonton Council for Early Learning and Care is to provide leadership in managing, planning, and supporting the development of high-quality early learning and care services in Edmonton, with an emphasis on meeting the needs of low-income and vulnerable families. The Council will build on existing capacities and work toward creating a system of early learning and care in the City of Edmonton. The vision of the Council is the early learning and care for all children that is early learning and care for all children that is high in quality, universally available, accessible, and responsible to the diversity of individual children and their families. Our mission is to design, promote, and build an integrated system of early learning and care that is publicly managed, supported by public funding, has a workforce that is appropriately educated and well supported, coordinates the range of services needed to support young children and their families, and contributes to eliminating poverty. The responsibility of the Council will be to conduct research and analysis of community needs for early learning and care in Edmonton, including consideration of the types of services required, locations and ages of children needing services, and evaluating services, especially in respect to eliminating poverty. Developing new structures to enable affordable, high-quality early learning and care services. Developing and supporting partnerships between local governments and community-based services, and to integrate early learning and care services such as the creation of local hub models for service. Designing and implementing strategies that build the capacity of community-based service providers and school boards to deliver high-quality early learning and care, including staff education and program delivery supports, such as designing guidelines for early learning and care spaces. One of our responsibilities will be to increase quality of services, by example, promoting goals and standards that exceed those established in regulation, and promoting culturally responsive early learning and care services, curricula, and training programs for service providers by engaging educational institutions and service providers who work with Indigenous and newcomer families and communities, and building community support, including public education for increased investments in early learning and care. Last slide. And so these are the members, the current membership as of March of the Edmonton Council for Early Learning and Care. There's City of Edmonton Administration and Poverty Edmonton, and the previous steering committee identified these partners. So the institutional partners are levels of government, for example, municipal and provincial, associated agencies, contracted organizations, elected boards, and publicly governed services that have legislative and or regulatory responsibilities for the functions that are relevant for planning and managing early learning and care in the city. The community partners are organizations that have expertise in areas related to managing and planning early learning and care. The council must maintain a reasonable balance in representation between the institutional and community partners. So that's where we're at as we embark on this journey.
Great, thank you to all three of you. And we're going to have a little bit of time for questions and comments again. We're going to, again, keep that time fairly short, and then we're going to go to some discussions at the tables that I'll direct you at that time as far as what that's going to look like. So we have a few, I'm going to say maybe again 3-ish questions or comments from the audience. Got one in the middle here and another one on the far side.
Hi. Thanks to all the panelists for being here and speaking about such important issues. Sandra, I'm wondering if you could speak more to what's being done to address the need for farm care.
Thank you for that. Right now, Friends of Medicare, along with our allies through the Canadian Health Coalition, have been working very hard on pushing the federal government. We participated in roundtables that were held by the advisory council that was just elected not too long ago, or appointed in last year's budget by Bill Morneau, and the one who's leading that is Eric Hoskins, who used to be the Minister of Health in Ontario. and he went around the province, and he has been tasked with creating a blueprint for this pharmacare program. So not too long ago, in the middle of the SCN Babylon debacle, we heard a very short report that kind of established the groundwork for the ultimate goal of having a national pharmacare program, but it didn't touch on whether or not it's going to be universal. And so that's what we're waiting for. In June, we will be hearing the final report, and at that point it will give us some guidance in terms of where we need to continue to push. And at that point, we're hoping that people will be ready to help us make this happen, because that's when all this political advocacy is going to take place. Here in Alberta, we've collected over 5,000 signatures so far. There's more. If you haven't signed our petition, sign it at the back. We're pushing our provincial governments, or all those who are hoping to lead us, that they need to kind of buy into this provincial, into this national program. So in the next couple of months, we're going to need all your support in terms of pushing this program through.
Great. And on the far side, over here.
Yeah, my question is for Navina. Now, Navina, you spoke in favor of universal income, as did somebody in the previous group, which I also support. But I'm very aware that, in fact, that the trade union movement in this country, for the most part, is not supportive of basic incomes, because they think that it's all a trap to push out existing programs. How do you respond to that?
Thank you, Alan, for that question. I think I would respond to that with understanding. I think it's not unimaginable that there are people out there. I mean, we've heard it since the introduction of the very idea of basic income. We've heard of proposals to have, something that's some money, and on the other hand, all the different programs would be scrapped. That's not something that Basic Income Calgary, the action group of Basic Income and Basic Income Canada Network that we're a member of, that's not the basic income guarantee that we envision for Alberta. And in fact, I would respond that we very much share goals and the vision with trade unions. We do not want a basic income guarantee to be introduced at the expense of anything. And in fact, we have our principles that we stand by. We don't, as a group of activists, we haven't worked out a design. We don't know if this will be perhaps a refundable tax credit or a standalone guarantee. That's not up to us to decide, but I understand those concerns, and I would respond that we need to fight for a basic income guarantee that would not be like that, and that would not crowd out all the other programs. And that's why also I spoke here today about the importance of strong public services for women. I see the benefits of having a basic income for women as a recognition of their unpaid work, but we also need to recognize how important public services are for the economic well-being of women.
Thank you. And last one, Rod.
I guess this is kind of a comment for Sandra and Nikki, because Nikki hinted about platforms that some of the parties are bringing forward. And to me, it's more like the platforms they're not bringing forward. We are very political, but we are also nonpartisan, but we're trying to get our members engaged in going and talking to those candidates who are running. And I got to go with some of our members, and they went to speak with a candidate in Central Alberta. And it was amazing. This fellow had been a previous chair of a health board before the systems were collapsed into Alberta Health Services. So he had some exposure with healthcare field. He didn't know what pharmacare was. He'd never heard of it. And he asked us to send him information. Like, how is that possible that people can be running for public office here in this province and not have an inkling? So,
You know what, that's a reality that we face all the time as advocates when we go and meet with representatives or people that are vying for our votes. And it is a reality. Most of these people go into it for other reasons. Well, not for other reasons, but certainly they lack the knowledge that important issues should have. And some of them don't even take the time to learn. So as advocates, one of the things that we've learned is that sometimes we know more than they do. And that's why going to meet with your elected official becomes so important, because they, at that point, become aware that there's issues. The other thing around the word pharmacare is that there's a pharmacy that opened up that's called pharmacare. And they kind of co-opted our name, the name of the program that we hope to establish, and gave themselves that commercial name. So, you know, a lot of people say, well, I hate that pharmacy, I don't want a pharmacare program. And so, I think that's not what we're talking about, but it's good to kind of know. And then a lot of farmers think that we're actually advocating for farm care. So,
Sounds like you've got some work to do.
Well, I guess, I mean, that's our experience too. And as you notice, there was only 2 lines, so that means probably 2 responses from 2 political parties. So that's my only comment.
All right, we're going to have to call that a wrap for this session. Thank you so much to all 3 of you. And sorry, I mean just a wrap for this panel. I don't mean you're going away yet. For the next session, we've got about 20 minutes or so. I'm compressing some of our timelines, and I want to get you talking at your tables. And so it might start with a quick round of introductions. I would suggest just your names in interest of time. And if you're at a table of 2 or 3, I would encourage you to join another table of 2 or 3, because I see several of those so that you get a few more people involved in your conversations. And you have a sheet on your table that's got a lot of blanks on it. This is what we're asking you to discuss. So you can do some reflecting on what we've talked about today, but what we're asking you is for your table to come up with 2 actions that you could take as individuals or as organizations, if you're affiliated with an organization, to advocate for government and political parties, really, because we're in an election, to make policy changes to reduce poverty in Alberta. So it's a big discussion, but I ask that you get into that and do your best to have a reporter fill out those 2 blanks, and I'll take a sample back from the room at the end. We'll get a few people to report back, and then we'll get you to hand them in at the end. So go ahead.
Yeah, you took 2 or 3 minutes at the start to kind of introduce. Did you? I forgot to take a shower. I don't know. Yeah, I did that. Please, do you want to
Most of it's literally, adding in. And then
Sorry.
It's such an interesting area.
My background has nothing to do
Think that your performance is such a wonderful
activism, both for electoral reform.
I made a note too. You are. Yeah, I knew that.
Just,
Anyway, so back to the top two.
something to control the
I said you wanted to get Yes, it is fun. On teaching, but although ours
I'm like, that must happen to you all the time, right?
Giving you another 5 minutes, so if you haven't started filling out the sheet yet, then make sure you have at least one thing, if not two, filled out on the sheet.
I think I'm like, yeah.
Anytime it's advanced income guarantee, later, that's much more. So it just guarantees that
I was going to suggest the articles about
no, everybody's guaranteed Can I ask this? What is your
Public guaranteed income from pharmacy.
But it's all income. Like that was the difference. It's all income here. You don't want to give money out. And they've got a lot of
Well, if I could throw my question, to me, a lot of these issues get shelved and solved because of the name of our building system, right? Just that the two-party structure, right? The parties with the ideas, the parties with the, that want to push this forward, are always shoved to the side. It's just not so if they so it's 30% of the vote. He's going to have all the power
Okay, we can wrap up your discussions for now, and we can, of course, keep talking in the break. I'm going to get Lynn, our mic runner, to come around to some of the tables, and what we want to do is to get some of your ideas reported back to the room. We don't have time for, can I get your attention, please? Thank you. We don't have time for every table to report back on everything that was that you filled out, even in your sheet, unfortunately. We are going to get you, at the end of the session, if one person could drop off your filled out sheet at the front table, that would be great, so that we have them, and then we can review them, and they'll actually go back to our Human Services and Poverty Task Force. And so if we can start roughly on this side of the room, like I said, we won't have time for every table, but we're going to try to make Lynn not run back and forth throughout this session and have her progress throughout the room. So can you put up your hand if one person can report back from several tables? So put up your hand if you've got one idea off your sheet that you want to share with the rest of the room. And we'll take maybe, I'm hoping to get 5 to 8 of them. We'll start with this table here. Yeah, just one of your actions that you came up with.
We thought supporting pharmacare would go a long way by speaking to your MLA and communicating with our coworkers, friends, and neighbors what exactly it is, what it stands for, and perhaps even having pharmacare, if they could afford to, get out in some media coverage, making some commercials and getting out more on social media so people are more aware.
Great. Thank you. And another table, yeah.
Hello. We, Universal Childcare, we would lobby for that. However, to be able to pay for that, I think that we probably need whatever party gets in, a tax structure that would allow that, so that you have the money to be able to pay for these things. Because right now we're just looking at the moon, so to go into a deficit to do all this stuff is nice, but it would be a lot easier if we had the money in place first.
And did you guys talk about what kinds of actions you could take to push for those things as well?
Oh, lobbying. We're from the United Nurses, so we lobby this all the time. Every patient that we see, we lobby for this type of for pharmacare, for for medications, because we see all the people coming into the hospitals, that have incidents because they don't have the medications that they need, or won't buy them because they're living on the streets and they'd rather have something to eat than take their medications, or looking for a place to live. What kind of choices do they make? Well, medications are usually the last one, so we see these people all the time.
Yeah, great. So yeah, leveraging the connections you have within your organization, especially when you're in a larger organization, to mobilize. That's great. All right, moving across the room a little bit, do we have a table or two in this area? We've got one hand over there.
Our table talked about several things, but the one I'm going to speak on is cheaper public transit. And the way that we would get that, we would raise property taxes, but making sure it goes directly to transit, not into the coffers. And what this would do is it would allow all levels of service for low-income seniors, anyone that's in need to get where they need to go at a very, a cheap rate. You're not just limiting it to those that can apply for it, but, maybe even going so far as I'm going to go out on a limb and say free transit, because transit is never supposed to make money. It's always supposed to be about providing a service.
Perfect. Another table in the kind of middle area here, if you want to. Okay, moving over to the far side of the room there. And if we can get one or two more tables after this, that would be great.
Oh, just one point, yeah, okay, so
Yeah.
one of those that we talked about was funding for mental health, so that with the argument that you're building community, because that's extremely important, monies for community leagues, for the mental health services at the various hospitals, all of that, because it's just generally, we were talking about upstream thinking, and it's really important to get across the message that prevention is as important as cures. It's more economical to help people than wait until they get to just a terrible condition. So there was some emphasis here on the mental health area.
Great. Upstream thinking is something we're going to hear about a lot this evening, so that's a good theme for us. We get two more tables over on that side to report back.
Hi, Chris from Edmonton Health Sciences. So we had quite a ranging discussion about a whole variety of things we don't like about just kind of everything. Because I mean that's what we're here to do, right? Is talk about stuff. One of the thoughts we had was in terms of political advocacy, we started to really think about putting a really heavy emphasis on advocating for a pretty substantial restructuring of how we collect our taxes. In terms of combating income inequality is sort of the underpinning on so many poverty-related issues. I won't go so far as to say eat the rich, because that might not be popular in this room. But very much that idea of there is so much money that used to be circulating in our public sectors and in our strategies and systems for social welfare that no longer does because of tax avoidance. And maybe some really heavy pressure to solve that problem could free up a lot of resourcing to tackle some of these issues.
Great, thank you. Can we get one more table? It's a table that hasn't spoken yet where somebody wants to share an action. I see discussion happening at that back table. Here we go.
Ben Henderson with Health Sciences. We talked about, again, a couple issues. The big one we talked about was ending racism and how could we look at that and deal with it. We thought about a ministry, something that would blend a couple avenues, though. We talked, education was one of the big avenues we looked at, and how to bring it in at the younger kids, the K-12 mentality, but more in the earlier years, the developmental years, the grade 1, 2, 3s, that type of thing. Those are the ones that, if we can look at getting rid of the stigmas and getting rid of the thought process on moldable kids that they don't understand or they don't see the differences. They just see them all as friends and working together and that type of thing. Because once they hit grade 9, 10, 11, 12, they've already got the images in their head. They've made their thought process for the rest of their life. And if we can look at changing them from that point, down in Cochrane, they've added a anti-bullying program, and it seems to be having a lot of results. They're starting with younger kids, and it seems that as they get older, the parents are getting on board because they're seeing it. I mean, we see it with commercial advertising that McDonald's comes out with a toy, well, then all of a sudden the family's at McDonald's for supper. Well, if we can work with the kids, we can get more results down the road because the parents see it in the kids. So you have a multi-generational change. You have the parents that see the changes, and the kids that are growing up are going to have the changed thought processes. So we thought starting with a ministry of that type that might look at a couple different avenues, that blend a couple different avenues together, might have a big result. Yeah, it's going to be tax dollars, but add $1 to every household in the province, you'd have enough money to cover a program like that. I mean, we're not talking millions and millions of dollars. We're talking small little steps that would take a few years to have a multi-generational change.
Great, thank you. I like the revenue rental. That's right. I was just going to say, I'm glad I heard a bit of a theme from at least a few tables that we need to raise more tax revenue to pay for valuable public services. That's what we've been doing a lot of campaigning on for the past year and more. Great, thank you all. And I now want to call up, so this is our last speaker of the workshop. I want to call up Ricardo Acuna, Executive Director of the Parkland Institute, who's going to wrap up a lot of what we've said here today and talk a little bit about going forward. And then I'm going to give you some direction on where we go from here, including just some logistical things. So please welcome Ricardo Acuna.
There's nothing like being put in the position of trying to wrap up 3 hours of fantastic presentations and information in 5 minutes while everybody's itching to try and go find some food before the debate starts. I was reluctant to kind of accept this role today for a number of reasons, not the least of which is that I'm reluctant to be the only male speaking on what has been a tremendous workshop and panel with amazing women presenters, and it's something that's incredibly rare in conferences like this, where you wind up with an all-female panel. So kudos to PIA for putting this together and putting it together in that way. I also don't know what I have to add to this. I mean, the work that was presented, the information that was presented,